In 2022, a Cigna medical director named Dr. Cheryl Dopke denied 60,000 insurance claims in a single month. Another Cigna medical director, Dr. Richard Capek, processed more than 80,000 instant denials in 2 months during the same period. The average time Cigna's own internal documents recorded for each rejected claim was 1.2 seconds. No patient file was opened. A computer algorithm called PXDX flagged a mismatch between a diagnosis code and a procedure code, and the physician electronically signed the denial without reading a single line of the patient's record. Over a 2-month period in 2022, Cigna doctors denied more than 300,000 payment requests this way, according to internal Cigna corporate documents reviewed by ProPublica and the Capitol Forum in March 2023. A former Cigna physician told the investigators, "We literally click and submit. It takes all of 10 seconds to do 50 at a time." Former Cigna executive Ron Howrigan explained the logic. Why deny only the cases you can prove are fraudulent when you can deny everything and wait to see what comes back on appeal? Cigna knew that only 5% of patients appeal denied claims. The denial is not the cost of doing business. The non-appeal is the profit model. Cigna called it accelerated payment. The algorithm kept running. The attorneys who litigated those cases do not carry Cigna. And the third plan on this list is one your broker has never put in front of you. Before we get to what those attorneys carry, you need to understand what you are actually buying when you choose health insurance in America, because the choice most people think they are making is not real. UnitedHealthcare, Humana, and CVS Aetna together control 56.9% of all Medicare Advantage enrollments in the United States, according to Oliver Wyman's February 2024 market analysis. UnitedHealthcare alone holds 29% of that market, covering 9.4 million people. Together with Humana, those two companies account for nearly half of all Medicare Advantage enrollment nationwide, according to KFF's August 2024 enrollment data. In 931 American counties, more than 1 in 4 counties in this country, just 2 companies control at least 75% of all Medicare Advantage enrollment. In Milwaukee County, Wisconsin, UnitedHealthcare alone holds 64% of the local market. In Washington, D.C., the same. For commercial insurance, 97% of all U.S. metropolitan insurance markets met the federal definition of highly concentrated in 2024, up from 95% a decade earlier, according to the AMA's December 2025 Competition in Health Insurance report covering 384 metropolitan areas. The brands on the shelf are not independent companies competing for your business. They are different doors into the same building. And that concentration has a direct effect on your claim. In Florida, in 2024, in-network claim denial rates ranged from 8% to 49% depending solely on which insurer a person chose, according to CMS Transparency and Coverage data analyzed by MoneyGeek. 2 residents of the same city, same diagnosis, same type of claim. One faces a 1 in 12 chance of denial, the other faces roughly a coin flip. Same city, different card. The brand you chose at open enrollment was probably the one that advertised most. That is the market working exactly as designed. Now let's talk about the mechanism. UnitedHealthcare deployed a tool called NH-Predict, originally developed by NaviHealth, a subsidiary it had acquired. The system analyzes patient data, including age, diagnoses, and pre-existing conditions, and generates a predicted length of stay in post-acute care facilities. Physicians' own recommendations about how long a patient needed to recover were not an input. They were an obstacle. The U.S. Senate Permanent Subcommittee on Investigations documented the following in their October 2024 report. UnitedHealthcare's denial rate for post-acute care services rose from 8.7% in 2019 to 22.7% in 2022. For skilled nursing facility stays specifically, the denial rate went from 1.4% in 2019 to 12.6% in 2022. That is a ninefold increase in 4 years. Internal documents reviewed by Senate investigators showed that UnitedHealthcare managers set a performance goal for clinical employees: keep patient stays within 1% of the algorithm's projected timeline. The algorithm, not the treating physician, determined when the patient was well enough to go home. In 2022, Jean Locken was 91 years old and recovering from a fractured leg and ankle in a Wisconsin nursing home. His doctor approved him for physical therapy. UnitedHealthcare and NaviHealth paid for 19 days of nursing home therapy, then determined he was safe to go home. His therapist said his muscles were paralyzed and weak. His family appealed. The algorithm prevailed. The family paid approximately $150,000 out of pocket to keep him in the care his doctor said he needed. He died in July 2023. This account comes from the class action complaint filed in November 2023 in U.S. District Court in Minnesota by Clarkson Law Firm on behalf of his estate. That lawsuit alleged that 90% of NH Predict denials were later reversed on appeal or by administrative law judge rulings. UnitedHealthcare has denied the lawsuit has merit. The Senate report concluded Medicare Advantage insurers are intentionally using prior authorization to boost profits by targeting costly yet critical stays in post-acute care facilities. This is not an error, it is a business model. The algorithm made the call on your care. Your doctor found out when the denial letter arrived. Here is what the industry is counting on you not knowing. Of approximately 85 million in-network claims denied on the ACA marketplace in 2024, fewer than 263,000 were formally appealed. That is an appeal rate below 1%, according to KFF's March 2026 analysis of CMS Transparency and coverage data. Of those appeals, 44% succeeded in overturning the denial. Nearly half the claims that were challenged eventually got paid. For Medicare Advantage denials specifically, UnitedHealthcare reversed 80.7% of denied requests when those decisions were appealed. CVS and Aetna reversed 90.8% of theirs, according to Muni Health's 2024 analysis of CMS data. The class action against UnitedHealth documented that only 0.2% of policyholders appealed NH Predict decisions. The business model was built on that number, staying small. Kathleen Holt, Connecticut state healthcare advocate, said publicly in 2025, "The insurance companies know that people don't appeal, and in some ways, I think they can be more aggressive with their denials. They do not expect people to come back." The claim denial business model is not built on being right about the medical necessity of the care. It is built on the certainty that you will not check. 3 things in a plan document predict whether a claim will be paid. One of them is never in the brochure. Your claim was denied. Your right to fight it has a deadline. Most people never find out what that deadline is until it is already passed. The American Medical Association surveys 1,000 practicing physicians every year about the prior authorization process. The December 2024 results were published in February 2025. 93% of physicians said prior authorization causes patient care delays. 82% said it leads patients to abandon their recommended course of treatment entirely. That is not a statistic about administrative inconvenience. That is a patient who decided that fighting the paperwork was harder than living with the condition. 29% of surveyed physicians reported that prior authorization caused a serious adverse event for a patient in their care. 23% involving hospitalization, 18% involving a life-threatening situation requiring intervention, and 8% involving permanent damage, disability, or death. 40% of physician practices now employ staff dedicated exclusively to handling prior authorization requests. 74% of physicians say claim denials have increased over the past 5 years, based on the AMA's May 2026 follow-up survey. And only 16% of physicians working with UnitedHealthcare and the same share working with Cigna reported that those companies' announced reform commitments had actually reduced the prior authorization burden in their practices. The people who see these outcomes every day carry different plans. This is why. If this is changing how you think about your coverage, subscribe. We cover the insurance industry every week. Now the data that explains what those people choose instead. The Centers for Medicare and Medicaid Services requires every major ACA marketplace insurer to publicly report its in-network claim. Denial rate each year under the Affordable Care Act's Transparency and Coverage provision. This data has existed since 2015. It is searchable at healthcare.gov. It is specific to each company. Almost no consumer has ever looked at it. Plan year 2024 data analyzed by KFF and published in March. 2026. Kaiser Permanente denied approximately 6% of in-network ACA marketplace claims. The national average was 19%. Oscar Health denied 25.3%. UnitedHealthcare denied 20%, down from 33% the prior year. The highest single insurer in Texas denied 36%. That gap between 6% and 36% is not a quality difference. It is a structural one. The policy you bought does not cover what the salesman described. What it actually covers depends almost entirely on whose name is on the card and whether you know what to do when they say no. Plan 1 is Kaiser Permanente. Kaiser is the only major health insurer in the United States where the insurance company and the healthcare provider are the same organization. Kaiser's physicians are salaried employees of Kaiser. Kaiser's hospitals and medical offices are Kaiser-owned. When a Kaiser physician approves a treatment and the Kaiser Insurance Division pays for it, money moves within the same organization. There is no financial relationship between a payer trying to reduce outflows and a provider trying to maximize reimbursement, because there is no separation between them. The adversarial structure that drives prior authorization denials at every other major insurer does not exist here by design. At UnitedHealth, Cigna, Aetna, and Humana, every approved claim sends revenue to an external entity. Every denial keeps it in. That financial incentive is structural, not cultural. KFF's 2022 Medicare Advantage analysis documented that Kaiser plans averaged 0.5 prior authorization requests per enrollee, compared to the industry average of 1.7. The integrated model eliminates the need for prior authorization on most internal referrals because the insurer is already making the referral. A CA Marketplace denial rate in plan year 2024, approximately 6% versus a national average of 19%, according to the CMS Transparency data. Kaiser operates in 9 states, and Washington, D.C., California, Colorado, Georgia, Hawaii, Maryland, Oregon, Virginia, Washington State, and the District of Columbia. For roughly 75% of the U.S. population, Kaiser is not available, which means the second plan matters more to most people watching this. Plan 2 starts with a number from a public database most people have never opened: the CMS Transparency and Coverage. Public use file lists the in-network claim denial rate for every ACA marketplace insurer, updated annually. The target is a denial rate below 10%. Kaiser holds 6. Outside of the integrated model, certain regional nonprofit insurers come close. According to CMS data analyzed by Value Penguin from the 2023 plan year, Providence Health Plan in the Pacific Northwest denied approximately 4% of in-network claims. Sanford Health Plan in the Northern Plains denied approximately 5%. These are not household names. They are the plans that pay. The second variable is the appeal window. UnitedHealthcare's commercial plans allow 65 calendar days from the denial date to file an internal appeal strictly enforced. Aetna, Blue Cross Blue Shield, and Cigna allow 180 days, according to MuniHealth's 2026 insurer analysis. A shorter window is not a formality. It is the number of days you have to build a case. Every call with an insurance company about a disputed claim should be followed immediately by a written summary sent through a verifiable channel. Patient advocates who handle insurance disputes professionally give one consistent instruction: if it is not in writing, it did not happen. Phone calls confirm nothing. The written record is what survives the appeal. There is also a formal process almost no one uses. When a treating physician formally requests a phone conversation with the insurer's reviewing clinician, a peer-to-peer review, denial reversal rates increase significantly on that individual case. Your physician can request this at any point during the appeals process. The insurer does not advertise it. Plan 3 is a legal right that 60% of insured Americans do not know exists. Every Affordable Care Act marketplace policyholder has a legal right to external review after an internal appeal is denied. An independent third party with no financial relationship to the insurer reviews the denial. The insurer cannot override the external review decision. This is codified in the Affordable Care Act. In 2024, approximately 85 million in-network claims were denied on the Affordable Care Act marketplace. Of those, fewer than 5,881 were taken to external review, according to KFF's March 2026 analysis of CMS Transparency data. Only 40% of insured Americans know they have this right at all, according to a 2023 KFF consumer survey. Connecticut's Healthcare Advocate Office, which helps policyholders navigate appeals, resolve denials in the patient's favor, approximately 80% of the time in cases where they stepped in. The third criterion is the insurer's documented overturn rate on first-level internal appeals. CVS Aetna reversed 90.8% of appealed Medicare Advantage denials. Centene reversed 95.3%, according to the Kaiser Family Foundation's 2022 Medicare Advantage prior authorization analysis. A high overturn rate is not evidence that the insurer is generous. It is evidence that the initial denials were wrong, and the insurer knows it. 3 criteria: lowest available denial rate from CMS Transparency data, longest available appeal window in the plan documents, highest documented overturn rate on first-level internal appeals. Where Kaiser is available, those 3 criteria converge in one plan at roughly 6% denial rate. Where Kaiser is not available, they point toward regional, non-profit insurers and specific BCBS affiliates with documented track records, and away from any plan that spent money fighting the publication of its own claims data. The claim denial industry runs on one calculation: that you will not read the public record, that you will not appeal, and that the cost of your confusion is cheaper than the cost of paying your claim. That calculation is available for anyone to examine. The data is federal. The source is CMS. It has been sitting there since 2015. If this changed how you think about your coverage, subscribe. We cover the insurance industry every week. And if you want to see how the Senate investigators built the case against UnitedHealthcare, line by line using the company's own internal documents, that is the next video on this channel.